Hi, everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on the topic of dental detox of metals in Des Moines, Iowa. Des Moines. All right. So, what is this all about? What's this dental stuff? In our patient cases, we often will see people having issues from underlying dental problems, right? They may have dental amalgams, which are the mercury fillings that people get in their teeth. Mercury does not just stay in the amalgam or in the filling, the mercury will off gas, meaning that vapor comes off. You can go to YouTube and look up a video called The Smoking Tooth, and they'll show you a image of a jaw with mercury fillings, and then you can, through a special types of imaging, you can see the mercury vapor, looks like mercury gas coming off these teeth. It's pretty crazy. Hi, Becky. Hi, Alyssa. Becky's asking me, what's the worst of two evils, a root canal or a foreign implant? Yeah. A root canal is a tooth. So I'm not a dentist, so I don't play one on TV. I'm a holistic physician. I'm a doctor of chiropractic. Hi, Robin. A root canal, my understanding that my dental friends have explained to me, is that you have a tooth, the tooth has an infection, and they drill out the infection. They drill out the arteries, the veins, they drill out the contents of the tooth. And if you don't have any blood supply to the tooth or little blood supply to the tooth will die. The tooth bone in your body is not like these weird concrete pieces. Bone in your body constantly rebuilds itself with osteoblasts, these little bone cells, and it tears itself down with osteoclasts, right? So your bones, people think, oh, I'm not growing anymore. Yeah, you are. Your bones are rebuilding with osteoblasts constantly and tearing down with osteoclasts. Your teeth are living bones. Bones are living, right? They're living pieces of your anatomy that have a nerve supply, they have blood supply. There's some people that are studying that the nerves from the teeth integrate with the brain directly, like they have integrations with that. Definitely have integrations with what are called cranial nerves. And these teeth can also be linked. So I can show you something that we teach in level 2. They also can be linked with different organs and glands in the body, right? Sometimes with patients, we'll find that they have a tooth problem, and then we link it to an organ or gland problem, right? So really, really, really interesting when it comes. Ooh, I made my camera blurry. Let's try to unmake it blurry. Fix. Let's see. Let's see if I can fix it. Kate, where are you? Let's try this. So sorry, guys. By showing you that, my camera got out of focus and I look like a big blur. Let's see. Come on, camera. That's better. Okay, good. All right. So hi, McCool. Hi, Robin. Hi, Jonathan. Hi, Teresa. Good to see everyone. So what is worse, a root canal or an amalgam or tooth implant? So the root canal, as it was describing, the contents of the tooth are gone. And in essence, you have a tooth that is dead in your mouth. How long will you do well with a dead tooth in your mouth? It's kind of like if you have a dead bone in your wrist, that bone goes necrotic or dead and can cause infection. Root canals, because the tooth is no longer in a healthy state, can attract infection, can have infection within them because they seal the top, they scoop all that out, they seal the top, and then in essence, you have a tooth that's breaking down. Dentists will tell you a root canal is temporary. What do you do about it? So the other option is an implant where they take a fake tooth and it has a stud, if you will, it has a connector, if you will, that goes into your jaw. That's metal. Is that any better? You may be able to get a bridge. So the bridge is connected to other teeth and has a tooth hanging on it, a fake tooth hanging on it. How is that? Yeah. So the tooth question is a challenging tooth. To me, it would depend on what's going on with the root canal. Some root canals seem to not have a negative effect. Some people can do pretty good with them. Where would the implant need to go, and can the jaw hold the implant? What about amalgams? Do all amalgams need to be removed? I would say no. And the reason being, in a case where the person's really, really sick, you don't want to add more toxicity to the case, meaning definitely you want to have a holistic dentist, someone, not a regular dentist, a holistic dentist who's trained by organizations like the IAOMT to safely remove the mercury. You don't want to just take those out, right? You want to make sure that the patient's on oxygen, that they have a special protective barrier in the mouth called a dental dam, that the amalgam's removed in a way that it doesn't leak further into the body. There's many precautions and different technologies and techniques of how to remove the amalgam. Some patients that we have are so sick that it would be a very bad idea to take amalgams out in the beginning because they're already toxic. They may have clogged toxic detox channels, right? If they're not using the bathroom in a poop way very well, then we don't want to detox them because they can't eliminate the toxins. If they have lung issues, they may not be a good candidate for that. If they have skin issues, they may not be a good candidate for detox. The dental world gets really, really complicated fast. If I had an ideal situation, we would have a holistic dentist working with a quantum nutrition practitioner. The holistic dentist specializes and very well trained in how to handle these matters. And the quantum nutrition practitioner, very well trained on how to help somebody rebalance the body and detox from mercury, arsenic, aluminum, different chemicals that are in the system, and make sure those detox pathways stay open so then you don't have any negative effects of that. Heavy metals, or say mercury in the mouth, can off gas. Those fumes can cross the blood brain barrier, get into the brain, and cause memory problems, concentration problems, Alzheimer's problems, dementia. You don't just get old and get dementia, right? People that have been around for a while have collected a lot of heavy metals and toxins. Unfortunately, when they're in the brain, they have a negative effect on the ability to concentrate. They have a negative effect on the ability to remember. They have a negative effect on the ability um, to be in now, be in present time, be in what's happening now. They have a great memory as far as old stuff goes, right? So when they were a kid or earlier, but present time stuff, like what they did in the morning, they may not forget. That becomes a huge problem when they take medication. Did they take their morning medications? Did they not? Did they turn off the oven? Did they turn off the stove? Did they lock the door? Did they close the door? You see in patients that have dementia and Alzheimer's, they have trouble remembering current things, and they become a risk not only to themselves, but their neighbors, right? They don't turn off the stove. They have something on the stovetop. It catches on fire. Their house catches on fire and spreads to the next apartment or the next condo or the next house. It becomes a huge risk. If we can identify the toxins, if we can identify the different heavy metals that may be negatively affecting the brain, we have seen improvements with concentration. We've seen improvements in Alzheimer's and dementia cases. We've seen improvements in memory. We've seen improvements in concentration, which is so, so cool. All right, a couple comments here. Robin says, removing my amalgams helped my health. Wahoo. It was definitely a process, and I was so lucky to have you help me in my oils. Yeah. So with Robin, we were able to do a program to help get her body ready for the amalgam removal, a program specialized for her during the amalgam removal, and then repair after the amalgam removal. So again, if you have a holistic dentist and you pair them with a quantum nutrition practitioner, which is what I am and what we teach, awesome results. If I ruled the world, all holistic dentists would have a quantum nutrition practitioner friend, or they would become quantum nutrition practitioners so they can test to see what kind of program does the patient need to be on before the amalgam removal, what kind of nutritional program or detox program would they need to be on during the removal, what would they need to be on after the removal to help with repair of that tooth, to help with repair of any nerves that were interfered with, to help with repair recovery, and make sure that no toxins were stirred up during the procedure. Michelle is going to get her bad root canal removed on Thursday. Awesome, Michelle. So hopefully someone like us is helping you with that process as far as what can be done when even root canals are removed. Paula says a biological dentist is a must. Yes, you do not want to see, you do not want to have a regular dentist remove the amalgam. You want someone who specializes, like a biological dentist or a holistic dentist that specializes in mercury amalgam removal, because there's a very specific way to do that. Jackie is asking who's a good holistic dentist. And so the one that we like is actually in Clearwater. So I can put you, oh, I don't have the link. Maybe I can pull up the link for you guys. Hold on. Let's get this link up. One moment, please. There we go. Natural and cosmetic dentistry in Clearwater. So had great success with this dentist. There are some that are closer in Orlando, but this is the one that has made the top of our list recently for the work that they do. All right, so let me pop this in the chat for you guys. Give me 1 second. All right, so holistic dentist team out of Clearwater, Florida really does an awesome job. So there's the link. Robin likes the idea of coupling a Q&T practitioner with a holistic dentist. Absolutely. Robin is saying it's called the SMART method. So the safe mercury amalgam removal technique, also known as SMART method. Okay, good. Awesome. And then Des Moines, what's happening in Des Moines? We are hosting our first quantum nutrition testing level 1 that's not Florida based. If you ask me where would people and students prefer to go, Iowa versus Florida, I'm like, Florida all day long with our beaches and our palm trees and our weather and just everything. But believe it or not, our Des Moines quantum nutrition testing level 1 class is completely sold out with a waiting list. That's happening this Friday and Saturday. One of our quantum nutrition teachers, Sarah Outlaw, will be teaching the class. I will also be there helping with drills and meeting you guys. A lot of our Epic Mastermind practitioners are also going to be there helping and assisting with drills, and it's going to be awesome. So excited. I don't think I've ever been this excited to go to Iowa. My previous trip to Iowa, I went to Davenport, Iowa to see where chiropractic was founded by D.D. Palmer, Dr. D.D. Palmer. That was really cool, but this is way cooler. Nice. Okay, good. So Michelle would love to go to Des Moines to the next one. So I don't know how, where our seminars going to be. The next off-site or off of Florida location is in San Diego in July. So beautiful hotel right on the bay there. Great instructor. Going to be awesome. So that's what I wanted to tell you guys. That's what I wanted to talk about tonight. I wanted to talk about dental can be causing hidden problems in your health. I wanted to talk about the detox of metals and how if you're going to have amalgams removed, you want to definitely detox the metals. You definitely want to see a holistic dentist. You definitely want to see a quantum nutrition practitioner. And then what's happening in Des Moines on Friday and Saturday? We're going to have our quantum nutrition testing level 1 course, packed house, sold out. So excited. Hope you guys are having an amazing night. If you need our help in any way, please reach out. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone. Bye.